Hey everyone, welcome to my birthday live stream. I'm so excited to be here with you guys. I can already see that there's a lot of happy birthdays coming through. I've gotten a ton through online already. I don't know if you guys know this, but apparently when you set LinkedIn to notifications that it's to let people know it's your birthday, instead of them posting on your timeline or wall or whatever they want to call it, it sends individual messages. So I think I woke up this morning to just an onslaught of LinkedIn messages, everyone wishing me happy birthday. So I can see already we've got some people popping in. I see Marissa, Camille, Lillian, yay, get up, Gemma, hey Teresa, hey Amanda, hey Anne. Really glad to see you all here today for my birthday stream. What better way to spend my birthday than with my channel friends? And also later on today I'm going to be doing a presentation for one of the AAPC chapters in Georgia on the evaluation and management coding update. So if you guys could just say hello, and so that I know you're here, and that would be great. So if you're interested, feel free to ask me any questions about medical coding. I do have a few things that I want to discuss today. If the questions don't come in, I've gotten a lot of questions lately that have come through email and Instagram and just comments on the Facebook page. And, thank you guys so much, because that video that I did on Tuesday, how to pass the CPC exam in 2021, is getting really great views. And I'm just really impressed by how fantastically that is performing. So for those of you that have shared that, liked that, made comments, thank you very much, because I think there's been a lot of questions coming through from coders that weren't able to schedule their exam in 2020, and they need to know, what do I need to do in 2021? And I think those office outpatient visit changes are really going to be a pretty predominant thing, because, if you're still using 2020 books, that's going to be the big one that is going to be changing. So I thought for sure, and I was wrong. And sometimes, I make my best guesses, and I'm not always 100% on the mark either. But I thought for sure that since previously with evaluation and management office visits, they gave you the level of history, exam, and medical decision making, that they would say, hey, here's your level of diagnoses, here's your level of risk, here's your level of data reviewed, so that you could compound that into the level. And it sounds more like they're actually going to actually make you score out evaluation and management visits now in 2021. So Seno, hello, thank you for stopping by and saying happy birthday. Someone that has a question, Hari says, does January month CPC exam coming as per 2020 guidelines or 2021? So for all AAPC exams, they change on January 1st. So that is when all of the new ICD-10 codes and CPT codes and HCPCS codes go into effect for the exams. So all of the exams right now forward, you can only test on 2021. There is no testing on 2020 guidelines anymore. I know AHEMA does it a little bit differently, but for the AAPC, everything changes on January 1 as far as the exam. So if you still have 2020 materials or are changed or were trained in 2020, make sure that you get updates on the 2021 guidelines updates. I don't have anything per se, but there are things that you can do. For example, if you have a subscription to Codify, they have resources in there that you can get listings and rationale, I think, even of all of the ICD-10 CM and CPT updates. They have listings in there, I think, even of all the codes that have been updated. I know one of the significant ones for 2021 CPT was a lot of the breast reconstruction codes were reworded a bit, so that might impact the exam if you get one of those questions. And of course, our office outpatient visits. One of the interesting things is there's actually case examples usually in the back of the CPT book for office outpatient, and as well as other E&Ms, and they took the office outpatient out for 2021 because they're like, since it's still a little bit of a volatile situation, we're still trying to figure out what cases are going to look like, how we're going to score, what is and isn't going to count based off of, because, we set up these guidelines and then we put them into effect, and sure enough, something's going to pop up somewhere that we didn't think about, and we have to revise and think, okay, in this scenario, this is how we're going to evaluate that, this is how we're going to score it out. So until we kind of see what's going on, they've just temporarily removed the case examples of E&Ms and the appendix in the back. So hello Natasha, hello Jenna, hello Senna for your wonderful birthday comments. So if anyone's wondering what I'm doing for my birthday, my birthdays, thankfully the last few years have actually been pretty good, because I have a tendency to have calamities on my birthday, things like getting stuck in the snow in my car, or just for whatever reason, bad things tend to happen on my birthday. Not as bad as my boyfriend. 2 years ago, he was driving to State College to go camping with his friends on his birthday, and his muffler fell out in the middle of driving on the highway, and he was trying to pull over, but there really wasn't anyone there. And then, of course, a cop found him, pulled him over, like heavily fined him for his muffler falling out, and wound up having too many points then on his license. His license was revoked. He had to go, he is the worst luck of any person I've ever met. So hopefully my birthday will just be calmer. I'm planning on just doing the live stream today. We have cupcakes for my birthday. I have a favorite cupcakery in Pennsylvania. It's called Sublime Cupcakes. So every year we get cupcakes from Sublime Cupcakes. My favorite is red velvet. And so we're going to do that. We're going to have cupcakes, and then I'm doing I have a mastermind call today, and I have a presentation at the Coming Georgia chapter on the evaluation and management updates then. So I know a lot of people have been asking me to do a 2021 E&M review. That's kind of a touchy thing, because, I have that one that I sell for $49 on my website. So I don't want to just kind of give the same material out for free, but I'll try to think of what I can do. If you actually go on the AMA website, I can show you guys this. There is some training you can get for free. Let me go over to, my Stream Deck doesn't want to go over today. Let's see if I can get it this way. Let me just switch my screen over. Ticker ZV1, cam with ticker. Oh, I think I have it set to, where is it? PDF something. There we go. Oh, where's me? I'm missing. There I am. Okay, so if you actually go into Google, and you can find it pretty easily through a Google search, it's on the AMA website. So AMA E&M 2021. So if you do go on the AMA website, there's the whole document here on all of the different changes that they've made, the new definitions that they have, how to score out an E&M. So if you're someone that likes reading the material and can interpret it well that way, you can do that. They have the whole grid here, stuff about the prolonged service codes, so you can get the information that way. The other thing is, they do have some training sessions on the AMA website as well. They're not my training sessions, but they are something that you can get. So let's see if I can find it here. E&M prep, related coverage. I know there's a training session around here somewhere. Let's see if we can go back and find it. I'm not always the best at navigating the AMA's website. Let's see if we do AMA E&M 2021 training. Here we go. So yeah, so there's a training module you can take right here with the AMA. If you go here to access the module, if you need more training on the 2021 updates, you can get it here, and it'll kind of walk you through. I don't think there's even audio or anything on it, but it does kind of walk you through some of the information and changes you can get on the E&M updates. So if you need information, you can always get it there. So let's see what we got going on. Oh, so I was talking about my birthday. So the other thing I'm doing so I got my mastermind call. I've got cupcakes, and I think my boyfriend's going to get crab cakes. I'm not sure, but someone asked. Oh, this is my Deathly Hallows necklace. I don't know. I feel like there's just so much going on in the world right now that I could just, instead of trying to make any kind of political statement, just be my ridiculous nerdy self and show off my love for Harry Potter instead. I think it's stuck. No, it's okay. We're good. So yeah, I'm wearing my Harry Potter necklace right now. Teresa says, happy birthday. Just want to thank you for the amazing videos. LPN going into coding. I'm so excited for this journey. I have had so many LPNs and RNs reach out to me in the past few weeks. I think it's just maybe the situation because of the pandemic, but a lot of LPNs and a couple of RNs, mostly LPNs, have reached out to me that they're looking into getting into medical coding. So my advice there is, I think one of the things you want to consider as an LPN getting into medical coding, I've heard a few people say that they do have to take an initial pay cut sometimes. That is something you do want to weigh. It might be a short-term cut in order for long-term gains, though, because LPNs are very well loved, particularly in things like documentation review, clinical documentation improvement. So while you may have to take a little bit of a cut for your first year or two, long term, once you can start getting into some of those advanced coding roles, like they love having people that have clinical knowledge doing audits and reviews and stuff. So yeah, that's absolutely great. And I really am happy to see more LPNs and stuff getting into medical coding. I'm extremely jealous of that, though, because I can take someone's temperature and that's about it. I can't do blood pressures. I've had some loving offers to teach me. I've done some education in the past where I've said, I don't really have clinical experience, but this is blah, 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 blah. And they're like, oh, well, we can teach you, we can just have you in the back seeing patients because you seem to speak very well and understand what's going on. And I'm like, no, I think one of the things about medical coders is the majority of us chose this field because we want to work in healthcare, but don't want to be patient facing. Oh, Camille, happy birthday to you. Your birthday was yesterday. You're going to have a piece of cake for me. Awesome. So someone's asking, is the E&M case that I sell have case studies? Yes. So at the end of the training, and I should probably preface this by saying that the evaluation and management training that I have is not the entire E&M section of CPT. So it doesn't go over like preventative medicine services. It doesn't go over counseling services. It goes over things like that you need to level out. So it's really truly how to score a history, how to score an exam, how to score medical decision making so that you can compound that into any level of service for whatever areas. So once you figure out how to score history, exam, medical decision making, you can code an ED visit, you can code an inpatient subsequent, you can code an H&P because you know how to calculate those pieces out. So that's the training that I do. And then I also go over the 2021 changes. And what I do is at the end, I go over case examples. And some of them I score on the old guidelines, some of them I score on the new guidelines, and then some of them I'll show you kind of like where the changes are. You can check out, I think there's some reviews of it on the website, contempocoding.com. And then if you hit the education button, it'll take you to all my different courses. So before I get too far else into anything else, I did want to do a plug in case anyone would like to contribute on my birthday and you are maybe planning on buying some anyway. Today is the first day of Girl Scout cookie season. Oh my gosh, that button's not working either. My goodness. Today's there we go. Today is the first day of Girl Scout cookie season, and my daughter Lizzie, who's 8 years old, is selling Girl Scout cookies. So if you go to this link up here, this link here, you can order cookies for her direct ship, and they will send them like literally right to your front door. And I don't know if any of you direct ordered Girl Scout cookies last year, but the shipping was pretty bad, and they've discounted it a little bit this year because they know a lot of people are going to be ordering online because of COVID. So if you are interested in ordering any Girl Scout cookies, you can definitely, I'll drop the link here. so that you can order some Girl Scout cookies. That's what I'm asking for my birthday instead of any sort of donations or gifts. Just order Girl Scout cookies for my daughter. She's got a hearty goal that she wants to hit. So what other questions have I got? Hello, Alpha Coding Experts. Hey, Tony, thanks for dropping by. Yeah, so Teresa, yeah, I think you'll do fantastic. I'm like I said, I'm just so jealous of the knowledge. That's one area that I really am hoping to improve upon in the next year, and I need to figure out a schedule for myself and hold myself to it of how I can better improve my more clinical knowledge. You know, I think even when I started out in coding, there was this kind of mindset that coders don't need to have as much clinical knowledge. And I think especially in the professional fee coding scenario, that's kind of been true because, you know, in more of the professional provider-based fee services, you know, the provider documents it and we just take that as, hey, whatever it is, we don't have clinical inference. So there's often, I think, a little bit of a lack in clinical knowledge, and that's something that I want to improve on over the year. I might have to get some flashcards or some books and kind of make a schedule for myself. You know, maybe Friday is personal education day or something, and I take that time and work on my clinical expertise. So someone's saying, are you planning to hold any other specialty courses for the people that are already certified? So yes, so I have one right now. I do risk adjustment. So I haven't released my CPC class because I'm working with someone else who I think can better drive that. Like they'd be able to, through the connections they have, potentially offer probably financial aid and stuff to students that want to get that. So I'm kind of gonna wait for that. So if that takes too long, I'll put my CPC course online, or if that falls through, I'll put my CPC course online. So I have my CRC right now online. I have a boot camp actually next weekend. If you're interested in that, check out the website. It's for coders that are basically looking for the CRC as a secondary credential. So you already know about ICD-10-CM, you already know about health insurance, so I'm not going to make you repeat all of the stuff you already know. We're just going to talk about what do you need to know about risk adjustment in order to pass the exam, and that's available on the website. So you can get information about that on the on my contempocoding.com website. And so I'm settling, getting things ready for that. I have another product that I'm hoping to release in February, but I will be looking into training for other credentials. I know I've had a lot of requests for auditing, that people want me to train for the CPMA. I've had some requests for the CPB as well. So I want to just get those out of the way first, like my new product offerings that I already have planned. And then I potentially will be opening up to other specialties. Oh, someone's saying the cookie link is not working. It should be bit.ly/cookieliz. Where is it? Yep. bit.ly/cookieliz. That's what it should be. If not, I'll drop it in my community tab otherwise later on, so there'll be an image in my community tab. Yeah, that's weird. I don't know why that's not working. So let me try one other thing. Oh, you know what? I would type it in manually, because sometimes YouTube is funny about posting links and stuff. But it should be. Let me try it out myself. Yeah, I don't know. That is so weird. But in any case, yeah, so specialty certifications. So in order for me to teach specialty certifications, first off, I can only teach the classes for whatever credentials I hold. So I can't teach the CPPM because I don't hold that credential. I can't teach the CPCO because I don't hold that credential. And the CPB I'm hoping to get this year. So once I get that, I can license to teach that as well. But the way it works is I have to pay the licensing fees in order to teach the course. And it's, they're discounted the more you purchase, but it is, a couple $1,000s. So I don't want to spend a couple of $1,000s when I don't know for sure if I've got a lot of students that want to take that. Also, if there are, that's a lot of money to fork out if I'm not going to pay, if I'm not going to have the capacity to put that program together until, July of this year. So it is something that I will be opening up as the demand comes through. So probably later in the year, you might start seeing more offerings for specialty certifications. It just takes a while for me to, get my existing programs put out, schedule the time to get the additionals. And I also have to have the funding. I don't want to make it sound like I'm broke, but I'm running, I run on very, tight budgets. To put it kind of that way. I don't have like $20,000 or $30,000 sitting on reserve in my company. It's not quite that robust. I think in the next couple of months, I'll probably have a bigger reserve of money to play with for the business in order to make those offerings available. So what else have we gotten here? Do you offer one-on-one tutoring on Zoom? It's something that I'm thinking about. I will tell you, if I do offer tutoring, it's probably going to land about $50 an hour. So right now, because I have other projects that I'm kind of working on, that's not something I'm going to be doing soon. I might, in the next month or two, open up a handful of sessions on that are available. But as far as one-on-one tutoring, you can also check on Wisent.com. There are a lot of affordable medical coding tutors there. And there is some on tutors.com. You can find medical coding tutors there. And Marissa, if you've seen her, she's going to be doing some stuff with the AAPC. I don't know, maybe she might want to take some tutoring. That might be a good side job for you, Marissa. So yeah, there's definitely a lot of opportunities out there in medical coding. I think one of the things that I love the most about what I've been doing is, it used to be you're a coder and you're a coder and you're always a coder. And it's just so fascinating to see how the industry has evolved and that coders have gone on to be auditors and compliance officers and work in the legal sector and work in the insurance sector and work in so many cool different ways, like training on EMRs and programming EMRs and doing charge masters. So there's just so many different ways you can evolve in medical coding. And I love the fact that I've been able to, and I'm not saying I'm the first, but definitely a more prominent one, someone that has taken things like live streaming and YouTubing and kind of that, I hate the word, but influencer culture and kind of brought it into medical coding. And I love just being able to do that. I was writing something the other day for the AAPC board of directors, and I was introducing myself as the Region 2 representative. And the piece that I wrote, it kind of said that, prior to getting into medical coding, I actually was a web design major and a pop culture blogger. So I used to write about things like pop rocks and toys from the 80s, movies, TV shows, and being able to kind of bring that in, that personality and that vibrance into the medical coding world, I think has been great. There's been so much over the years where people, they're like, we have to be professional and we have to, do this at all times and wear suits and pantsuits and ties and, present ourselves in a certain way. And I'm like, but I can also like Harry Potter and play video games, and I don't see why I should not be able to put that personality out there. I mean, we're kind of in a culture now where people are embracing your weird. And I think as long as we're not overstepping our boundaries and being rude to other people or anything like that, like, I mean, let your nerd flag fly, right? And it's crazy how much podcasting has picked up in medical coding. Like, I think every other day I log on LinkedIn and someone's starting a podcast. And the fascinating thing about it is, there's like niches within niches. Like, people are doing, a medical coding compliance podcast, and then they're doing a career development podcast. And then there's ones where people are like, oh, well, I'm doing it just on, financial aspects in revenue cycle. So it's not even like we're all doing this exact same podcast. Everyone has their own kind of definitive little niche that they have an audience for. And clearly there's been an audience, there's been this for a long time, and I've spoken in the past how bored I used to get when I would watch just these slides go by for these webinars that we would have subscriptions to, and it would just be like da 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 da, thank you for logging in to today's webinar. Please, if you're using a phone bridge, stop at this time. And I'm going to be completely honest with you. I think those phone bridges were happening quite a bit. So yeah, it's really fascinating to see how the industry has evolved over the years, and I love that. So someone is saying here, I just saw it. What's a good first job for an RN new to CPC with past experience in ICD coding? You know what? You might actually want to consider risk adjustment, because that has so much to do with diagnosis coding. And that's another area where I think LPNs and RNs are going to be really good, because there's so much there's a little bit more clinical validation, I think, in risk adjustment. Like, you can see if a patient has a certain diagnosis, and if they are on a medication that is treating that diagnosis, then it's an actively being treated, and you can code it for risk adjustment. So I think that would be a fantastic opportunity for LPNs and RNs to get into risk adjustment, because I think validating a lot of those diagnosis codes would be fantastic. So if you are interested in seeing some more about like what risk adjustment jobs are available and what that entails, let me get over here. So if you go to codersdirect.com, that is a website that is exclusively for, well, I think they have a couple of non-coding positions, and it's a little slow loading, but they have positions that you can search for just in medical coding, and you can narrow it down by what your credentials are, and that can help you find a job. So here's some of their recent listings, and sometimes they do post salary information in there, so you can kind of get a feel for what's available. Like right now, oh my God, Weller HCC is hiring risk adjustment coders again, contract, full-time. I've seen a lot of people, by the way, if you're looking for a job right now, I swear to God, Change Healthcare must be hiring 100 million coders, because I have seen so many postings lately about, hey, is anyone else starting at Change Healthcare? Is anyone else starting at Change Healthcare? So they seem to be on a bit of a hiring spree right now. I don't know much about them other than they send a ton of information to people about, audits. I mostly know Change Healthcare for sending us the benchmarks and saying, hey, your provider's billing a lot of 99215s, and based off our measures of comparable cases in that area, they should not be billing so many 99215s. But it seems like they're picking up, getting a lot of contracts, hiring a ton of coders. So you can narrow down on Coders Direct by your location. You can look for remote. You can look by credentials. So if you're interested in looking for like a risk adjustment job, you would want to have the CRC. And excuse me, the CRC, I probably passed it. Everyone probably saw it but me. Right there it is. So excuse me. So you can check online and see exactly what kind of jobs are available there. And the guys who run this website, they're very, very nice. Rich and, oh gosh, I forgot the other guy's name. Rich and Mark. So there's a lot of positions you can find on there. So that's where I always tell people to go if you're just researching things about medical coding and you want to know what kind of jobs are available, what they might entail, is to head to Coders Direct and start looking at things. So there's a comment here. My boss preferred a medical profession to be assigned as our medical coder. Feeling sad about that mindset. I'm not in the medical profession, but I do love studying it for myself. So there are certain types of coding roles where, because of the clinical knowledge that you might have, they do tend to prefer people with clinical backgrounds. There have been people that have been huge advocates about the HIM field, like Brian Quee and, oh gosh, I can't think of the other guy's name. I'm blanking. It's my birthday. And that's all I'm thinking about is that cupcake I haven't gotten yet. But yeah, there's people out there that, historically the HIM field had a lot of people doing like clinical documentation improvement that were registered health information technicians or administrators that went through college. They didn't have clinical skills, like they can't catheterize a patient, but they know all of the clinical knowledge, the clinical knowledge. And then a lot of organizations switched over. They're like, we just want RNs and LPNs doing this, primarily RNs. And now we're kind of trying to switch that mindset back and going, hey, just because they don't have the hands-on clinical skills, they still have the knowledge. And if all they're doing is reviewing records, like, why do you need someone who knows how to do the hands-on stuff when that's not what they're doing? They're just reviewing the records. So I think there's a big movement right now to kind of get rid of some of that mindset. Would it be appropriate to ask how much the average salary is of a medical coder? So that is actually a topic of my video for Tuesday. I have that recorded. I haven't edited yet. So yeah, Tuesday I'm going to be going over the statistics that we have from AHIMA and the statistics that we have from the AAPC on medical coding salaries. And I'm going to break it down by years of experience as well as credential. So I can show you the data for that. But if you go in and check, if you can Google either AAPC salary survey or AHIMA salary survey, it'll give you that information about, I think the last one they have is probably 2019, because, you know, that was what they put out in 2020 based off of 2019's data. AAPC, I think in the next month or two, is updating their salary information, but I can show you guys, see if I can bring it up here on my website, because I do this on my video and I can show you guys quick. There is a coding salary search that you can do. So if you go into the medical coding salary calculator that the AAPC has, you can select your location and it'll put out kind of some, based off of their data that they've collected, what your approximate salary should be. So let's say you're living in Colorado. Your role is primarily doing coding. You're a coder specialist. And let's see, where's the certifications? Primary certification is your CPC. It will put together that information about what your average salary should be. So it tells here about $54,381. And again, that's average though, that's not starting wages. But you can even break it down, then it'll tell you what that average salary is by state as well. So that's a cool tool that you can check kind of what's comparable for averages in your area. But again, those are not starting wages, they are average. Destiny says she loves my CPC review. Thank you. Yeah, so if you need a review for the CPC, I do have a very affordable one available on my website. You can definitely check that out. How hard is it to get your first job in coding without credentials? So that kind of depends. So there's a couple of factors. So first off, if you have no experience at all, you are probably going to be able to get into healthcare at a very lower tier, like maybe something like registration, and then maybe start working your way up. There are organizations that will hire coders that are actively pursuing their credential, that they're maybe in a program through the technical school and are going to sit for their coding credential soon. There's some people and some organizations that have like coding apprentice type of roles, like that you're someone who just kind of pulls reports or data or kind of helps out the coding department. Sometimes if you've at least hit that point in your education where you have knowledge of insurances and denials and, you know, the CMS 1500 form, you could potentially get a job in billing. So it really kind of depends on your proficiency there. It is hard, I will tell you, and you know, it's the hardest thing I have to communicate to people is that it is tough to get your first medical coding job. I mean, sometimes, you know, I don't want to say you get lucky, but the environment perhaps is right at that time in order for you to find a job. But there's yeah, it's hard. And one of the things I'm going to be putting together is some career development packages to kind of help coders out with some of that, as far as how they can promote themselves, how they should, you know, appear, how to do remote interviews and that kind of thing. So that's the information that I have on that. Bananarama says, my company is a vendor for Blue Cross Blue Shield. We only code prospective and retro. I like the retrospective reviews. I do too. I said, the funny thing, been asked a couple of times why I got into auditing. And I think one of my initial things that drew me to auditing is I was someone who was very timid and a bit of a introvert growing up. I still am quite introverted, actually. And people liked to always seem to point out to me what I was doing wrong, and try to kind of almost like they were trying to tell me what to do. And I liked a little bit of that thought process of, ooh, well, now I can kind of tell the doctors what they're doing wrong and how they should be fixing all the things that they're doing. And so I kind of like the retrospective reviews too. Any tips or tricks for learning body systems faster? I'm really slogging through it. Probably something that you would maybe need to visually do. Go through some diagrams, go through some YouTube videos. As far as the body systems, there's some nice anatomy and physiology videos that you can watch online. I don't know if that would be a flashcard thing that you could do, but that's just something that I don't know. Learning them faster. Keep in mind too that if you're talking about learning them faster for your exam, there's a lot of illustrations in some of the books. Like the AAPC edition I know of my ICD-10-CM book has a lot of illustrations that probably aren't in some of the other versions of the books. And that's something that's helped me out, because especially I know oftentimes in the exam they like to ask you questions about the blood flow through the heart. And if you have the illustrations there with the little arrows pointing like where they're going, it can really help you out. Off the top of my head, I could probably not recite to you how blood flows through the heart. So I would be one that would need to look at a diagram anytime I would be trying to figure that out. Is it possible to get a free retake of the CPC exam in person if I failed the CPC exam online the first time? So from my understanding, what the AAPC does is they will allow you to transfer from in-person to online, but if you're at an online exam, you only get one attempt. So if you want another attempt, you do have to pay for an additional attempt. What coding specialties are best for introverts? That's a good question. I don't think there's any particular specialty as far as like gastrointestinal or surgery or E&M that would be better for introverts. I would say it kind of depends on what the format of your employer is. There are some employers, for example, that'll hire auditors and all they want them to do is pump out audits and they don't have to work with the providers. But a lot of organizations, they want you to be able to have those difficult conversations with providers and give them that feedback and education. Same thing with regular coding positions. Sometimes they do want you to work a lot with the providers. So I wouldn't say that's necessarily a specialty thing as far as what's good for introverts, so much as a job task and cultural thing of your company. So it might just be better to try and seek out employment at an organization that, if you're kind of introverted and don't want to, I don't want to say interact, but you don't want to have those difficult conversations with providers or, interrupt them or that kind of thing. If you don't want to have those kind of interactions, I would say try to find an organization where they want the coders to just kind of code and that's it, that they don't want them kind of talking to the providers. And there are some like that, and some people, are more suited for that. That they'll say, hey, if there's an issue with the provider, just let me know, manager, and I'll take care of it with the provider. So less about the specialty, more about the organization and the culture and setup of that particular organization. So for those of you that are just coming in now, thank you for all of the happy birthdays. And then I did also want to mention, like, if you are, for my birthday, if you want to, help me out, give me something instead of taking donations or gifts or whatever. Today is the first day of Girl Scout Cookie Day. So if you are looking to direct ship some cookies to yourself, my daughter is selling Girl Scout cookies. So feel free to to order some Girl Scout cookies to celebrate my birthday. Or if you're interested, there's also, super chats and all that stuff you could do. Also, while I'm in the process of, I guess, plugging things between questions, if you've ever been interested in joining channel membership, there is a membership that you can join for the channel. I have different tiers from $1.99 up to $9.99 a month. So if you're interested in joining the channel membership, what you can do is there's a little join button there, and you can join the channel. What it does is you get community only posts. If you are in a gold or platinum membership status, I actually add your name to the end credits of my videos so that you can see it, and it says, thanks for all of our members, and I'll have your name on it. And then Carol's saying I'm shameless. And you also get free CEUs at all tiers. So I have a couple, I think 2 free CEU programs. One is ICD-10 CM guidelines. I can't remember what the heck the other one even is off the top of my head, but there's a handful of CEU programs that I have that I posted just in the community only tab for the members only. So if you have a paid membership, you can get access to those. And it's basically the content that I kind of already have on YouTube, but I've transformed it into a course. There's some quizzes you have to take at the end, and then you can get CEUs for doing that, if that's something that you're interested in. So there's that available. And and then boot camp's coming up next weekend for the CRC, which I think is fantastic. And I still have the on-demand available if you're interested in taking it on demand and kind of doing it at your own pace. So someone says, I'm from India and CPC certified. Can I get jobs in other countries like the US? Yes, I know there's organizations, for example, like Harmony Healthcare hires a lot of overseas coders. As far as how that works out with taxes, what the criteria are, since I've never personally done it, I've never been involved with hiring coders overseas, I really can't advise too much in that aspect, and I apologize. It's just not something that I'm aware of what the salaries are, what the expectations are, what the requirements are. I do know that, privacy is a big concern because HIPAA can't be enforced overseas. So there's a lot of considerations that companies will take in regards to that. So someone's asking, is it worth getting a specialty certification through AAPC as far as getting a better salary, or how should I work towards something like risk adjustment or auditing? So I think specialty, did I put this in one of my recent videos? Where did I talk about this recently? Maybe it's in the video that's coming up on Tuesday. But I think any additional certifications are absolutely 110% worth it. I think they are, though, a long-term investment, particularly for new coders. So, it's good to show that you have proficiency in certain specialties. I think that's a fantastic way to do it. But what that does is it doesn't mean you're going to immediately get a boost or immediately be able to get a job. What that does is it puts those blocks already in place so that when you go to apply for maybe an auditing position that opens up in your organization, or maybe you go for a specialty type of coding position, you can say, hey, I've already demonstrated proficiency because I already have this credential. So it sounds a lot better, for example, to say, oh yes, I would love to be placed into this compliance position. I already have my CPCO. I'm already a certified professional compliance officer, versus, well, I thought about getting that compliance officer certification. Like, I've been thinking about it. So what do you think is going to sound better to the person you're interviewing with? I thought about getting it, or I have my credential. So even if maybe you've not worked in that before, you have that credential, you're like, I already kind of know what I'm doing. I can prove that I've passed this exam, so that when that opportunity comes up, and they see, oh yeah, you've already been coding for a couple of years and you clearly know in your good cultural fit, because that's another thing, that you can then be better suited for that position. So someone's asking, is it possible to get a job as a coder without CPC? Yes, I have seen some people get coding jobs without their CPC. Oftentimes what I have seen organizations do is they will preface that. They'll say, we will hire someone who does not have their CPC yet or who does not have their coding credential, but they will set a stipulation that you have to have it within 1 year of your date of hire. So that can be a little bit of a predicament. So, you know, if you wind up not getting your credential within that year that they've set that stipulation in your contract, you could wind up losing that job after a year. So, you know, while there are jobs, you know, make sure that you get on that right away with getting your certification. Because if you get your position and wait 10 months maybe to take that certification exam and then you don't pass it, you might not be able to get in to get another exam in time prior to your year expiring and would wind up losing your job. So yeah, that's one of the things definitely to consider. So there are some out there, probably not easy to come by, but there are positions out there that do hire coders prior to them having gained certification. So someone's asking, I just got my CPCA. Where can I get experience? And who hires CPCAs? So there's actually, and I love this, but there's a lot of organizations now that are coming out with internship programs. One of the things I have for a future video is I've gotten a lot of questions about the Practicode, and I never took it. I'm not sure it was even an offering when I became credentialed, but I have no idea what the heck it looks like because I've never taken it myself. But I noticed that they have specialty Practicodes now that are like for advanced coders. So I signed up to take one of them so that I can speak a little bit more to like what it's like, and I can relate to some of these people that are asking me questions more. So now I know what it looks like, and I might be able to post some things. You know, I'm not going to show you what the cases are in them, but to kind of show you like what it's structured like and my thoughts on it. So that's something that'll be coming up. So that's a way to get some experience, is to get your apprenticeship removed through that Practicode that they have. And I think there's organizations like OS2 Solutions. That girl that runs that, she is phenomenal. But as far as getting experience as CPCA and who will hire CPCA, so one of the things you can do is go back to that codersdirect that I talked to, and there is a section in here where you can specifically search for CPCA jobs. So this will narrow down your search just to people that are willing to take apprentice coders. And so if you're looking for remote, if you're looking for a certain state, you can search on their website and find more information specifically for people that are willing to hire apprentice coders. The other secret that I have that I say is that if you have like a healthcare organization, an insurance company, a hospital near you where you are looking to work, like one near me is Tower Health. So if I was a new coder, I would go right onto Tower Health's website and look on their actual website for positions, because oftentimes they're not going to, you know, they have a lot of demand for people that want to get in. So they might not even waste their time like publishing advertisements, posting things on Indeed. So go right to those organization websites and search there. Search CPC, search coder, search medical records, you know, or just look at everything that's in there under, you know, administrative or something like that, wherever they classify their coders under, so that you can get that listing and see what's available specifically for those organizations. Is there a reason why coding books seem to be so expensive? So that is a great question. I think ICD-10s tend to be a little bit cheaper. So one of the things I can tell you is, so the ICD-10 code set, this is publicly available. I mean, you can't find it with all of the bells and whistles and pictures and color codes and everything on it, but you can download this from the Center for Disease Control website. You can download this from the CMS website. It is a publicly accessible, like free use code set. CPT is copyrighted by the AMA. They own CPT. If you've ever noticed these yellow dots on the bottom, so these yellow dots on the CPT manual, you will find those on some currencies as well. And what it does is it prevents copying. So they basically, they protect this book like it is currency. They are very, very protective of their copyrights. There have been instructors that have gotten in big trouble for copying pages, for you know, shooting video of every single note that they have, making copies of every single note that they have, because it's the entirety of the book. And they don't like that. So it gets a little finicky as far as CPT. So because of the value of their code set, they tend to charge a lot. And oftentimes, like, they also own the guidelines too, which is why you can't just go online and like download CPT guidelines like you can for ICD-10 CM. And oftentimes you can find cheaper CPT codes that don't include the guidelines. I think sometimes they refer to them as like the expert editions or something, because I guess maybe you're such an expert you already know the guidelines, but those tend to be cheaper because they haven't licensed that additional information from the AMA. And there is actually surprisingly quite the bootleg market for CPT books. I'm actually pretty surprised. Yeah, so Beaver with a Chainsaw, yeah, the job website is codersdirect.com. So you can find it over here. It is codersdirect.com. So it's a great website, great resource for finding medical coding jobs if you're looking for something, and it helps narrow down. And of course, Indeed. So that's another video I should probably make, is how to find a medical coding job in 2021. Because I think there's been some changes probably in that even since last year. And CEUs, I have to do a new how to get CEUs for free in 2021 as well. Let's see, what else have I got here? Yeah, so Coders Direct, CODER. I'll put it in the website. Hold on, put it in the chat. codersdirect.com. You can also follow them on LinkedIn. And then when you look at your LinkedIn feed, it'll post all of the new positions that they have. Another good thing is to follow my buddy Bertram Lantiquos. I'm sorry, I'm probably butchering his last name. I can never pronounce it correctly. But he has positions that he posts as well. So get on LinkedIn and follow some of those recruiters, because they'll just post stuff and it'll pop up right in your feed. Speaking of feed, have you guys used this new Clubhouse app? I keep hearing people promoting it, and I'm like, oh, this is cool, I should download this. And I downloaded this, and I'm like, okay, this, everyone's saying how great it is. I guess they're using it for like drop-in audio to just call people up. And that might be something that maybe eventually might be good for coders, to be like, hey, you know, I'm looking at this case and it's, ooh, someone messaged me. I'm looking at this case and it's blah, 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 and like bounce some ideas off of people, because I guess it's audio only. But I primarily do, like, I'm a video person, so for me, it's not something I'm like looking to get into right now. But that might be something cool for the coding industry. I'll have to think about how coders might be able to utilize that. Oh, yeah, but then of course we have to be careful because of HIPAA. We can't give MRNs and stuff through that, because I am sure Clubhouse is not HIPAA compliant. So someone's asking, are newly certified coders able to do remote medical coding? In the past, not usually. Now that we've gone through this pandemic, and are still going through it, unfortunately, there is a lot more of that happening. So, so I think because of the pressure, you know, sometimes these terrible scenarios, they kind of force you into things. And we've had so many organizations over the years that like, we can't do this remote, we can't do orientation remote, we can't have people working remote right away. And now that they've been forced into this situation where it's like, well, now you have to, they finally have kind of turned around and gone, oh yeah, you know, I guess technically we kind of can do this. They've just not wanted to because they're stuck in their old ways. So, you can, I definitely think that there's going to be more availability to coders to, find remote positions when they're just newly certified. I think it's just that we've finally gotten creative enough in the industry to make that happen. Just give me 1 second. My boyfriend's texting me. Okay. Whoop, that was not auto text. Oh my gosh. So, free CEUs. Yeah, I have to get some more stuff put together for free CEUs. If you're looking for free CEUs, I'm going to put this in the chat too. If you go to hitnots.com, That is a listing of all upcoming webinars and resources and on-demand stuff for CEUs for AAPC and AHEMA. So check them out. They will be able to direct you to some stuff that's coming up. There's also the AAPC free quarterly webinars. If you're not familiar with those, you can just go into our trusty friend Google and type in AAPC free quarterly webinars. And let's see, I don't think this takes you directly to it, but there is a link in here. Beep, boop, 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 boop. Free quarterly webinars. Maybe not. Okay, let me try one other thing then. Oh, I hope I'm not logged in. I don't want you guys to see my member ID number. Okay. Let's see. Resources, networking, education. It might only show when you're logged in, but I know there is. Here it is. I think if you're logged in, there should be something that shows up here in continuing education with resources for free CEUs. I don't want to log in because I don't want to display my member ID right now, but there is usually a tab over here that kind of shows you. I'll put it in one of my future videos so that you guys can see it, and it will show you the free CEUs that you have available. I'm taking too much time in CPC exam to answer my questions. Any tips to overcome it? Yeah, watch my last video that I just did, how to pass the CPC exam in 2021. And that gives my tips and tricks on how to answer the questions faster. As far as if you're already going through those strategies and it's still taking you longer than, you know, the average 2 minutes, you just need to keep practicing because you have to just pick up the pace. There's no real way to just kind of say to do it faster other than practice makes perfect kind of in those scenarios. Will my CRC bootcamp be available for purchase after the live classes? So if you want it on demand, it's a lot of the same material that I go over through the on-demand course, so you can buy the on-demand course. The CRC bootcamp, I do give the videos, recordings of the bootcamp afterwards. I'm going to have another one, I think in March, depending on how things go, possibly February. So I will be hosting more of them if it's not a convenient time. I don't know how people feel about the 2-day thing. I don't want to do it all in one day because I will lose my voice speaking for that long on one day. Plus, that's a long time to sit in front of your computer for an entire boot camp. So I will be hosting additional boot camps. If you want to take it on demand, I do have a full on-demand course that has all the same information, plus I think more CEUs, more videos, a lot more information if you want to take it on demand. Someone's asking, where did I just see that? Do remote coders have to talk on the telephone a lot? Not usually. Even I, in a lot of my positions, didn't spend a lot of time on the phone. This is so funny. I was working at my first coding job, I think maybe it was my second coding job. Yes, it was my first coding job, and it was when we had that big, oh gosh, where everyone was getting laid off and we were having all kinds of problems with the economy because the economy crashed and everything back in the late, maybe like of 20, what would that have been, 2008, 2009. But in any, I don't want to say depression, but whatever they called it back then. And, you know, we were trying to budget cut. So one of the big budget cuts that they made was, hey, we have all of these people working in revenue cycle that don't really need phones. So one of the things they did to reduce the budget was go around and take everyone's phones off of their desk and their phone lines. And definitely the coders and people working in charge entry and people working, you know, that weren't calling insurance companies, had the phones removed from their desks. So I don't think coders, especially in the remote field, talk a lot on your phone. You'll probably need to connect with your coworkers via like a Zoom application or Teams or something like that. You might have to, if you don't have a good microphone like I do hanging out here, you would probably have to call in with your phone. I've even had to do that sometimes because my microphone wouldn't connect for whatever reason, but it's not like you're calling insurance companies or getting pre-authorizations. You might get phone calls from doctors if you're like sending them a request that you say, hey, you know, I need you to do an addenda on your documentation, and they call you up to talk about it. You might have phone calls like that. So that is it. We're actually at 12 o'clock now. Thank you all for coming in today to chat with me. I would love it if you hook me up with a big thumbs up. There will be a video of this. For whatever reason, YouTube, I feel like popular YouTubers, they do a live stream and like 5 minutes later it's up on YouTube, but I guess maybe since I'm not as popular, it takes like 12 hours for YouTube to upload my live stream onto my channel afterwards. But you know, if you're interested, feel free to join channel membership. Again, I said I have some CEUs in there. It's only $1.99 a month for the lowest tier. It is a subscription that, you know, rotates, and then up to $9.99 if you want like my blooper reels and videos and that kind of stuff. So thank you everyone for hanging out with me today. I truly appreciate it. And thank you for coming in and wishing me a happy birthday. Yeah, so I'm going to go. My boyfriend's bringing me lunch, and I'm going to have some cupcakes and come back on Tuesday because that's when I'm publishing that video about salaries for medical coders. And it sounds like some of you have some great information on that. And thank you guys. Thank you so much. Like I am just in awe. I've never gotten this many happy birthday messages in my entire life. So thank you everyone. And most importantly,